Thank you, Alosh. Hi, everyone. I'm Shivani, and I'm the co-host for today. And I work as quality scientist in GSK. And recently, I've joined ALIBSA as a volunteer as well. So we have our wonderful admins, the CEO, Dr. Adi Odumusu, and Dr. Fatiha, who is a founder and director, Alush, who is a webinar lead, and Toby Fatola, who is our media and communication lead, Dr. Abulanle Adisopi, who is our operations and event lead, and Dr. Zengma, who is our output lead. We have our other admins who's also working with us, Marcia May, who is our grants coordinator, and Akinabi Shakiro, who is our secretary. A big shout out to all our volunteers who is working tirelessly to make this a successful event. Aisha, Dr. Hadi, Rodia, Aziza, Laika, myself, and Ayula. So for the agenda for today's webinar would be initially to introduce the webinar and introduction of the guest speaker and have a webinar discussion, which is dementia evitable? How to protect your brain? That is the main discussion of the webinar, followed by Q&A, comments and feedbacks, and we will have closing remarks. Before we start the webinar, we would ask everyone to please be on mute for the free and successful webinar. We would also ask you to please switch on your camera. We would be happy to see your lovely faces. And you could ask your questions by raising your hands, or you could put in the chat box.
So thank you so much, Shivani, for explaining how the webinar is going to work. So I've mentioned at the start about the participatory research that ALIBSA is part of, that we do. So we have got such an opportunity now. So this is part of the Asthma Plus Lung UK and the MRC. So the project is to for anyone who has issue with their lungs. So this is an equal breath survey. So if you are from a Black or mixed Black heritage and is living with a lung condition, we want your help to do this research. So the project will also give you £10 cash as a thank you for your participation. So there is a separate survey for adults, and there's another one for children as well. So if you get in touch with us on the email at hello@alibsa@gmail.com, then we would be able to support you with this project, because it needs some input from us as well for you to complete the survey. So it'd be wonderful if you could be part of the survey. So, or if you know anyone else who might be part of, who could be part of the survey, please let them know as well. We will share these in the WhatsApp groups as well. So even if you miss this webinar, do not worry, we'll ensure that this is available for you as well. So without talking anymore, without taking any more space, I want to introduce you to today's webinar and our speaker, Dr. Nadasia Mominigwa. So thank you so much, Nadasia, for presenting the webinar today. We are eagerly waiting for your presentation. She's an Alzheimer's research fellow at UCL in London, and she accepted our invite to present her talk about dementia. So I will stop sharing, and I invite our speaker to take on to the stage.
Thank you so much, Alosh, for the lovely introduction. I'm just going to share my screen. Just give me one moment. Great. Can you see my slides?
Yes.
Fantastic. Yes. Great. Well, I'm really happy to be here. As Alosh said, my name is Dr. Natasha Mwanigwa, and I'm currently an Alzheimer's Research UK Fellow at the UK Dementia Research Institute at University College London. I've been a postdoc at UCL for 3 years now, and I was awarded my fellowship last year in October. So for the next 3 years, my work will focus on trying to understand what actually goes wrong in the cells that die in people with Alzheimer's disease and other types of dementia. But today I wanted to use this opportunity to talk more about general awareness about dementia. Interestingly, this week is actually Dementia Awareness Week, so I think this is super timely that I'm here giving this talk. And hopefully through this webinar, you can get more appreciation that there are things that you can actually do to lower your risk of dementia and protect your brain health. So just a quick overview. So as I said, this talk will be mainly about dementia awareness, actually understanding the difference between dementia and Alzheimer's disease, a lot around risk reduction and brain health, a little bit about getting a diagnosis, and also as a researcher, I always want to drive home the part about people, especially from Black and Asian communities, being involved in research. So just to give some context and lay the foundation of this talk, I think it's really always grounding to hear the stats about how dementia is impacting everybody globally. So currently about 55 million people in the world are living with dementia, and this is very likely an underestimate. And 60% of these people are living in low and middle income countries, which is interesting because I think historically, sometimes dementia was seen as kind of a disease of the West or disorder of the West, but I think as time is progressing, we're starting to see it become more prevalent in other areas of the world. And the global impact is about 1.3 trillion, probably again an underestimate. So I'm based in the UK. I think many of people on this call are also in the UK. And interestingly, it's the leading cause of death in the UK for about the last 3 to 4 years. And something that's really important to note is that people from Black and Asian communities are vastly underrepresented, both within research, but also in awareness activities. So just to ground again this talk in... Sorry. So just to ground this talk again in what dementia actually is, there's often a lot of confusion in what dementia is because people often interchange the term dementia and Alzheimer's disease. But dementia actually refers to it's an umbrella term that's used to describe many different symptoms, including memory loss, which is often associated with Alzheimer's, but also confusion, personality changes that affect somebody's ability to engage in their day-to-day activities. And there are many different types of dementias. The most common is Alzheimer's disease, which is why people often confuse them. But there's also other types of dementias, such as vascular dementia, which is more prevalent actually in Black communities because it's associated with high blood pressure, which is more prevalent in people from Black backgrounds. Also frontotemporal dementia, Lewy body dementia, and there's other dementias. And it's important to note that most people with dementia actually don't present with only one type. Most people actually have mixed dementias, and the only way you can really know which type of dementia someone has at this point is after they pass away, and you can look at their brain under the microscope and really definitively say which one they have. But usually the clinicians can do a differential diagnosis based off how the patient is presenting, and that's currently how, along with some blood tests and some scans, how you can diagnose and categorize which type of dementia someone has. But what's important to note again is that dementia happens as the brain gets damaged over time, and it's not a normal part of aging. So I always try and show this slide because I think it gives people a better appreciation that actually when somebody has dementia, there's something physically happening in the brain. It's not that somebody's just changing. So on the left, you can see an image where you see on one half of the side to the left, you see what a healthy brain looks like. And on the right, you can see the brain of somebody with advanced Alzheimer's. And I think you can easily appreciate that the brain of someone with Alzheimer's is shrunk. And here you can see where my pointer is, there's this area that's called the hippocampus. And all you need to know about this area is the part of the brain that controls memory. And you can see in the healthy, you have this nice pink tissue. And in people with Alzheimer's disease, they lose this tissue. Therefore, that's why they actually lose memory. So you're actually losing the parts of your brain that controls your ability to form memories. And on the other hand, if you even look closer and you look at the cells inside the brains of people with Alzheimer's disease, in the healthy brain, you see all these normal cells and the tissue. But in Alzheimer's disease, you see an accumulation of proteins. And depending on the type of dementia, you have different proteins that accumulate. In the context of Alzheimer's, you see what we call amyloid plaques. And we also see these tangles from this protein called tau filling up the cells. And so, again, this is just to note that when somebody has dementia, there's something that's actually physiologically happening in their brains, and this gets worse over time. So what are the symptoms of dementia? So I kind of already alluded to this a little bit. So some of the common symptoms you tend to see across most of the dementias are things like memory loss, personality or mood changes, progressive difficulty with daily tasks, difficulty in concentration, changes in behavior, and balance and movement problems. But I think something I also want to drive home is that depending on the type of dementia that you will have different disease-specific symptoms. So, for example, in Alzheimer's disease, you see memory changes, mood changes, getting lost, difficulties with reasoning. However, somebody with vascular dementia may have symptoms that are more problems with planning, trouble following series of steps, and sudden periods of confusion. Whereas one of the main features of frontotemporal dementia is that people show socially inappropriate behavior. So they can have very dramatic personality changes. You could have somebody that was super sweet, super nice, super calm before suddenly being very aggressive. And sometimes people, like, it can be very confusing, but sometimes this can actually be indicating that somebody has something going on in their brain. And then finally, with Lewy body dementia, this one is quite related to Parkinson's disease, but it's a different diagnosis. But you see people with Lewy body dementia having depression and anxiety, hallucinations, problems with sleep as well, and mobility issues. So again, this is just to show that dementia is quite a spectrum of different disorders, and depending on the symptoms, this can help also the clinicians diagnose what kind of different type of dementia an individual has. So there's different risk factors associated with dementia, and it's really, I think, important to understand them. So in terms of the non-modifiable risk factors, we have age. So the biggest risk factor for dementias, for all dementias, is age. So the older we get, the more likely that we are to develop dementia. Sex is also a risk factor that, you can't really change it. You're born with your biological sex. And certain types of dementia are more common in some sexes than the other. For example, Alzheimer's disease tends to be slightly more common in women, but Lewy body dementia tends to be more common in men. So just depending on the type of dementia, there is some sex differences. And then we also have genetics. So around 1 in 100 cases of dementia are caused by faulty genes. So the majority aren't caused by at least genes that we're aware of, but some of them are genetic, so they're passed down in the family. These tend to be more early onset. So people who get early onset Alzheimer's, etc., it tends to run in the family more. Before I go on the next slide, I'm going to move on to kind of the modifiable risk factors, and I wanted to maybe open up the floor to the audience. Like, what do you think are other risk factors, modifiable risk factors that affect dementia? So if you want to just maybe put in the chat what you think before I go on the next slide, just to see if people have any ideas. Or maybe unmute, I don't know, whatever's easy. Maybe Alosh, I don't know what's easy, if people just put in the chat or if people unmute and just say.
I think people can do either. I think mostly people put that in the chat. I think for me, I think one of the things I have learned is physical activity. I think that helps. It's one of the modifiable risk factors.
Yeah, great. So just to give people a hint, there's 14 known modifiable risk factors. So yeah, so exercise, lifestyle. Any other ones that people? Checking the chat.
You said diet. Have we said diet?
Yeah,
Exercise.
diet. That's a good one. Any other thoughts? Just one more maybe, then I'll do the big review.
Trauma.
Oh, trauma. That's an interesting one. Yeah. Absolutely. So this is a slide with the, sorry, I'm gonna remove this. There we go. This is a slide showing the 14 known modifiable risk factors for dementia. This was published on this Lancet report. They do this report every 4 years, I believe, where they take all the research that's going on all over the world and see if there's any trends that are linking certain behaviors or risk factors to dementia. And I'm sure some of them are not surprising, but some tend to surprise people a bit more. So lower education, and I see someone wrote excessive alcohol consumption, correct? So this is right here. So lower education in early life is one of the early risk factors for dementia. And then we have untreated hearing loss, which actually surprises a lot of people, but actually it's one of the risk factors that if people actually got their hearing loss treated, would reduce the incidence of dementia quite significantly. So I always tell people, if you have people in your life or if you yourself are starting to struggle with your hearing, it is always worthwhile to get a hearing aid. Sometimes there's some cultural barriers that like discourage people from getting hearing aids, but it's really, really important, and it can actually protect you from cognitive decline. So, and then there's like, you know, the cholesterol, diabetes, I think high blood pressure, obesity, these ones are kind of well known to affect your health more broadly, but actually also impact your brain health. Depression, smoking, traumatic brain injuries. So someone said trauma. So yeah, we see that people who have had traumatic brain injuries through playing certain sports, or if they had some accident, increases their risk of dementia. Physical inactivity, air pollution, visual loss as well. So untreated visual loss as well is another one that, again, if you are having problems with your eyesight, it is worthwhile to go get checked out, get glasses, get treatment. And social isolation is a really, really important one. Being human beings are, you know, we evolved to be in community, and it really, really does make a difference to your health when you are in community with people. So it's really important that as people get older, we find ways to make sure they're still engaged with people within their communities and with each other. So so kind of in summary, this slide just takes all these together of things that you can actually do to reduce your dementia risk. So staying active, no smoking, try and limit your alcohol, eating a balanced diet, take care of your hearing and your eyes, prevent or manage your diabetes and manage your blood pressure if you're hypertensive, manage your cholesterol, look after your mental health, stay socially connected, and also stimulate your brain. So whether that's through puzzles, whether that's through games, whether that's through reading, all these things can really help to protect your brain. I'm just really going to briefly touch on getting a diagnosis. Obviously, this varies from country to country. I'm speaking mostly from the UK context, so you have to take this obviously with a grain of salt depending on your context. But generally what happened, well, firstly, the importance of getting a diagnosis is it enables you to get the right help and treatments and support services as soon as possible. And also, I think one really important point is it allows time to plan your legal, financial, and future care decisions. And I think that's really important to allow people who do have dementia to have autonomy for as long as possible and to be allowed to make the choices that they want to make for their future care. And also ultimately also allows you to participate in relevant research or clinical trials that are available. So how it typically works, at least in the UK context, is that you'd have an initial consultation with your GP, and if there's some reason to suspect that you may have dementia, you get a referral to some specialists. So you go to a memory clinic where there's a battery of different tests that you do, as well as specialist tests like MRI scans, for example, to look at your actual brain. And depending on the outcome of the memory clinic, the specialist tests, and a review from a specialist, you can end up getting a diagnosis. I'm saying this very simply, aware that this is not always how easy it is for this to happen. This is how it like in an ideal world, this is how it should go. But we all know, like with the NHS and everything, it's not always straightforward. But you know, this is just to give you a bit of perspective on, in principle, how it should work. And in terms of treatment, there's currently no cure for dementia. Most of the treatments at the moment are to alleviate people's symptoms, and there's also complementary therapies that are used, like aromatherapies, music therapy, massages, you know, anything that can help alleviate symptoms, and make somebody feel comfortable for as long as possible. However, it is an exciting time in research now, because in 2023, the first two drugs, so lecanemab and donanemab, which are the first two drugs that have been approved and have been shown to actually slow down the progression of early stage Alzheimer's. The caveat is that you have to be in early stage for these drugs to actually work for you, which means you have to have had a diagnosis early. So obviously there's a bit of limitation there, but this is actually the first time in the history of humanity that we've had actually drugs that are actually able to do something. So I think we're really feeling more excited now in the research world that we're starting to have breakthroughs, and there's a lot of clinical trials that are happening now that are showing some promise in this area. So I think, you know, in the next 5-10 years, we're really hopeful that we're going to start having some breakthroughs, like some of the other fields, like, you know, cancer had its breakthrough like about 50 years ago, and I think the brain health space is now catching up. So I think we have reason to be optimistic for sure. And yeah, I think the final part for me is just talking a bit about why research participation is really important. So obviously I'm from a Black background, and I've looked a lot into how poorly represented people from Black backgrounds are, but this is also true of people from Asian backgrounds within the UK. And again, this is UK context. I will say that the US is doing slightly better in terms of this, but not by much, but they're doing a little bit better than the UK. But this is all to say that when you look at most of the clinical trials happening, very few of them actually even report ethnicity at all. And the one UK clinical trial that I could find that actually reported ethnicity only had about 5% of participants that were from minoritized ethnic backgrounds. So again, it's really important that people from all backgrounds are represented, so that we know that the drugs that we're developing actually will work in people from diverse backgrounds. The data sets that we work with as well, in the labs are very skewed. So UK Biobank is this really big data set that is used globally. It's one of the biggest in the world, with genetic data and longitudinal data, but it's about 96% white European ancestry. So again, you can see where the limitations are in the research. And generally, there's just very few studies on ethnic minorities in the UK. And so again, this is something that I've been thinking about a lot. And I mean, I can talk about it later, but I've been doing a lot of public engagement work to try and reach people from particularly Black communities and see how we can start to improve the representation of people from these backgrounds into research. But there's a lot of trust building that has to happen there, because there's a reason why people aren't engaging in research in the same level. So these are some of the things that I'm also working on alongside my research. But ultimately, research is the only way that we'll find new ways to prevent, diagnose, and treat dementia. And I think, sometimes people find the idea of research quite daunting. I think we need to do a better job as researchers of demystifying what it means to participate in research, because it's not always giving a blood sample or being in a machine. Sometimes you can literally do a study from the comfort of your home on a computer. I mean, actually, I think just now Alosh was showing that the lung health opportunity to participate in research, where it's sometimes the survey and things like that. So there's many ways you can get involved in research. It doesn't always have to be invasive. So I think just keeping that in mind, and being more open, because we really need everyone to be engaged as much as possible. And there is this website called Join Dementia Research, where you can see available studies that are there, and you can pick for yourself, what you're comfortable with. Some of the studies are paid, some are not. Some, you have to be present. Some you can do at home. So it's something I always encourage people to just explore for themselves, and obviously only do things that you feel comfortable with. But there's so many ways you can get involved, for sure. And then, lastly, I think I always want to make sure that we also acknowledge that dementia doesn't just affect the individual with dementia, but it affects the entire family and the community around them. When somebody develops dementia, it causes a profound shift in roles, the emotional burden of the family of watching a loved one basically, lose themselves. And there's this concept of ambiguous grief as well, where, somebody's still alive, but it feels like they're gone. And it's a very difficult emotional weight to carry, when you can see somebody, but you're not able to engage with them in the way that you know them and remember them. So, caregivers often experience poor health themselves, anxiety, depression, and financial impact. So again, it's really important that we look at dementia as a holistic experience, not just for the person impacted, but also for the people around them who then have to be caregivers. And yeah, it can be really, really devastating. And so on that note, there's a lot of different organizations, at least in the UK. I mean, I'm sure I know this is being recorded, but I can also share this slide with the team in case people want, the links, and I can share like a list of resources as well in case anyone wants to find these different organizations. But there's many organizations like Alzheimer's Research UK, Alzheimer's Society, etc., that provide support and information, which I think is really helpful. And then globally as well, I know there are people on the call from different areas of the world. So there are other organizations as well. Alzheimer's Disease International is a global program. I'd recommend going on their website, because they have all the different organizations in other countries as well. In Nigeria, there's Alzheimer's Disease Association of Nigeria and the Gabby Williams Alzheimer's Foundation. In Ghana, there's this Alzheimer's Related Disorders Association of Ghana. And I'll just share these as a resource afterwards, so that, depending on your context, you may be able to find where you can get information and support. So final take-home messages. Dementia is not a normal part of aging, and it results from progressive changes in different brain cells. All forms of dementia are progressive, which means that they get worse over time. And Alzheimer's disease is the most common form of dementia. Many of the risk factors are modifiable, and there's things that we can do to protect our brain health. Early diagnosis is key for planning and access to support. And yeah, and as I said, research participation is crucial, and we need more representation of people from Black and Asian backgrounds so that we make sure that any treatments, any interventions that we're developing will be more equitable and more reproducible regardless of who you are. So yeah, thank you so much for your attention. Happy to have an open discussion and questions. Yeah, thank you.
Alosh, I think you're muted.
That's a good catch. I was saying that was a really, really good presentation. I think it was very compelling, and then it also gave us things to actually do. There was very actionable things, especially around the 14 risk factors that we can modify, and also the steps that we can do as well for us, but also for our family members. I think for the younger group within the webinar, I think this would be quite key for that as well. So thank you so much for the presentation. I'm sure that we've got plenty of questions to go through as well. Before that, could we take a picture, a screenshot of the screen, if that's all right? And if everyone could turn on their cameras, then that would be great. Shivani, would you be able to do that?
Yeah.
Terrific.
Just one more second.
Yeah.
Yeah, all done. Thank you.
Well, so just share my screen.
Okay, so we do have a question.
2 seconds.
Okay,
Sorry, Marcia. Sorry.
that's fine.
Just before we go into questions, I don't know whether Anle is in the call, but from ALIBSA, we just wanted to wish her happy birthday, and then she's a rock for ALIBSA as events coordinator manager, but also for her presence within the webinar. She's normally always here, so I hope she's in here. But if so, we want to wish her happy birthday from the behalf of everyone at ALIBSA. So we'll go straight to Q&A. Thank you so much.
And my better and better one day. I mean, I only took one part of my program, then immediately.
Could we mute everyone? And then just Marcia, could you, sorry.
Yeah, so we have a question from Aisha. Thank you, Aisha, for your question. So how do we distinguish dementia from the memory loss just due to the aging process?
Yeah, thank you for that question, Aisha. So the thing is, one thing to keep in mind is that when somebody has dementia, memory loss is often not the only thing that you see. So if somebody only has memory loss, then that just might be normal aging. Obviously, as you age, you start to lose your memory a little bit. You might, your mobility and stuff and things like that. But typically with dementia, it's not only memory loss, it's also then the mobility issues or personality changes. And I think what's important to also notice is it getting worse over time? So it's one thing to just forget about, like, where are my keys, or I forgot where I was going. And it's another thing when you start to forget people within your life, that's not typical of age. And usually, you'll still remember your loved ones, including even your partner, your children. But in dementia, you start to even lose that. So I think it's trying to distinguish that with memory loss with aging, it tends to be more subtle and more, around losing things, maybe being a bit forgetful. But with dementia, it's progressive, it gets worse, and it becomes to a point where your daily function becomes impaired.
Thank you for that. And Artist Kid, 29, just made a statement. I think you addressed it. And they said that it's rare that for a person to be aware that he or she has developed dementia. I don't know if you can elaborate on that, but it's the familiar people, I guess, family who notice the subtle changes.
Yeah, absolutely. This is 100% true. And it actually is a challenge as well in getting somebody a diagnosis, because often what happens is that maybe the family members notice something, but then even if you mention it, the person might be resistant and say, no, I'm fine, like everything's fine. Also, that weight of that term dementia for some people is quite scary, so that they don't want to engage with it. So it is often people around you who will notice it. And one thing that I heard this suggestion from a GP is that if you have someone in your life that you suspect something is going on, keep a journal and note down, the dates of when certain things are happening, so that one, you can present it to the person, but also if you then need to go to a GP, you have a clear log of why you are concerned, and you have date stamps, and then you can also see, because it can be quite hard to be able to, be sure if you're noticing something. So I think keeping a little diary log of just like, okay, I noticed this day they forgot this, I noticed they had a fall, then this can also then be helpful when you need to go and speak with the GP, because sometimes then if the person does have dementia, they may not be able to represent themselves fully when they go to the GP. So this is advice I heard, which I think can be quite useful.
Yeah, very good advice there. And Shavna has asked, is dementia seen only in old age?
Yeah, so majority of cases of dementia are in old age. For example, Alzheimer's disease typically only develops after the age of 65. However, we do have various early onset dementias. So you have early onset Alzheimer's disease, which can already begin in late 40s. Frontotemporal dementia tends to be more earlier onset. So you even have people in their late 30s or 40s starting to develop symptoms and having a shorter lifespan. The early onset dementias tend to be genetic, so tend to run in families. Usually with Alzheimer's disease and the other dementias, you typically see them coming up. So it's not only seen in old age per se, but the cases of it happening in younger age are much more rare, but they do happen.
So I guess they may be aware that they're at a higher risk of developing dementia.
Sorry?
If it's genetically linked, Okay, yeah. So another question is, why do dementia patients live longer than expected?
Why do they live longer than expected?
That's a question, yeah.
I'm not sure I understand the question.
So Abdul Wakil, I don't know if you want to add anything else to your question. There's another question is there any specific age that an individual may develop dementia? So is there a specific age individual develop dementia?
Yeah, as I mentioned before, it depends on the type of dementia. Typically, it's after the age of 65 is the average age, at least for Alzheimer's disease, which is the most common. So usually in after the age of 65, the chances of getting dementia start to increase quite a lot. So between 65 and 70, I think the rate goes up 30-40%. So after the age of 65 is where you start seeing it. But again, as I mentioned, if you have early onset, it can be younger. So it depends from person to person, because obviously there's always variability in people's bodies, their health, etc. But I'd say 65 plus is when you start to see more cases coming up. And then after 70, 80, then it rises quite steeply.
So I guess it's about keeping healthy in early age and doing those things, the modifiable
risk factors, exactly.
Yeah, we can take to minimize the risk in our later age. I know you covered this, but Abraham was just asking how many types of dementia there are.
Yeah, so there's quite a few. I think in the slides that I showed, and I appreciate some people came a bit later, but there are quite a few, but the main ones are, sorry, I'm just going to go back onto my slides. I know I'm not sharing the screen, but just for me to have a look. There are about there's four very common ones. I say very common, or four more common ones. So Alzheimer's disease, which is the most common, that's around like 70% of cases. Then you have vascular dementia, which is the second most common, which I mentioned is a bit more common in people from Black backgrounds, because vascular dementia is associated with high blood pressure, which is more common in people from African ancestry. There's frontotemporal dementia, which is the one where you have a lot of behavior change, and then Lewy body dementia. So those four are the four most common. And then you have others. So there are still like others. There's mixed dementia. It's I feel like with brain disorders, it's always a bit of a spectrum of classification. So I would say there's four main ones, and then there's the others. So just say like, yeah, five more broadly.
Okay, thank you. So yeah, it's not just, as you said, it's not just Alzheimer's. That's the umbrella. There are lots of different ones. Docky, so does the dementia affect the vocal cord or the voice? And also, could the dementia cause Parkinson?
Yeah, so in terms of it could potentially affect someone's voice, because sometimes with people, when they, particularly frontotemporal dementia, it's affecting kind of the frontal part of your brain, which is responsible for controlling kind of your personality, and so you might see some differences there, depending on the type of dementia. In terms of dementia causing Parkinson's, so Parkinson's is a distinct diagnosis altogether. So most people with Parkinson's do not actually develop dementia. Although there is a diagnosis, this is where things get confusing. There is a diagnosis called Parkinson's disease with dementia, which is a different thing from Parkinson's disease, but it's quite rare. Most people with Parkinson's disease actually have, like, their brain health actually is fine. Like, they don't have cognitive decline. They're quite sharp. What they lose is then their mobility more. So that's kind of the distinction. But I mentioned in the types of dementia, there's a Lewy body dementia, which can present with Parkinsonian. It has, like, people have mobility issues, but it's not Parkinson's disease. So they're distinct diagnoses. They're different. But of course, sometimes, again, with all these brain disorders, they can be overlap. But there's to answer your question, dementia doesn't cause Parkinson's. It's its own kind of diagnosis.
Okay, thank you. So the next question. So yeah, we're getting some really good questions in. So do keep your questions coming. So the next one was, how can dementia be diagnosed early in order to get useful treatment? And I guess this is coming from, I know that you mentioned treatment available currently, but the question was, how can we access dementia diagnosis in Nigeria?
Yeah, so it's a good question. I have to be completely honest that that's not a context that I'm particularly familiar with, as I'm based in the UK. However, as I said, I will share the resources from the Nigerian context. I found a couple of organizations that specifically work with dementia, Alzheimer's disease in Nigeria. So I'll definitely have a look at that. What I will say, though, is in terms of early diagnosis, this is something that is there's a big push of that in research right now, because it's not actually very easy to diagnose dementia. At the moment, we're relying on seeing if somebody's behavior has changed enough that we can say that something's changed. And then in the UK, at least, which is of course a high resource, relatively wealthy country, you get brain scans, you get blood tests. But what is currently in development is they're trying to develop a really simple, inexpensive blood test where you can actually detect some of the proteins that accumulate in the brain when you have dementia, just like, when you do like any kind of, rapid test with blood. This is still in development. It's something that we're seeing. It's still like in the labs, but we're hoping if they can get this through in the coming years, then this will also make diagnosis easier in also low resource settings, because one of the limitations obviously is, I'm from Zimbabwe, so having MRI scanners and stuff is just not practical at the moment. It's just it's just not feasible. We need the funding for that. So there's definitely limitations depending on where you live in the world, which is unfortunate. But hopefully, as we continue to develop research and find inexpensive ways that we can actually diagnose and then get people access to the treatments that they deserve.
Yeah, I think in all areas, medicine, things are moving rapidly, which is really good. And that's linked to the next question. Someone has read something that they said that by the year 2040, there would be a cure for dementia in the UK. I don't know if you know, is this true? Have you heard anything? Have you read anything that there's possibly a cure?
I would be skeptical about a cure, but I would be optimistic about treatment, because I think there's a distinction there. And I think often it's something that I also had to have perspective on, that often we want a cure, which makes sense. But if you think about a lot of conditions that we have, we actually don't have cures for a lot of things, but we have is very effective treatments. And if we use the example of HIV, for example, right, we don't actually have a cure, but we have really effective treatments that people can have full lives, they can have children, they can have good quality of life. So I think that what we have, like the 2 drugs that were approved 3 years ago, are the first disease modifying therapy. So they actually slow down the progression of disease in people with early Alzheimer's, which shows that we're now actually able to do something to slow it down. So from my perspective, just being like, I'm very much like in the research, a cure is unlikely, but a treatment is definitely on the way in the next decade for sure. So I think we have a lot of reason to be optimistic. And sometimes a treatment is enough if we want people to just have good quality of life. If you're diagnosed at 65 and a treatment allows you another 20 good years of life, it's kind of like balancing what does good treatment look like for a disorder like dementia or Alzheimer's disease.
And I guess one way to help with the increasing pace with cures or treatments is for people to take part in research.
100%. Yeah.
So there's an interesting question here from Paymo. Are older people with learning disabilities susceptible to early dementia?
So in terms of older people with learning disabilities, I'm not sure, but what I do know is that people with Down syndrome have a 50% chance of developing Alzheimer's disease. And this is because they essentially sort of have a it's the genetics for people with Down syndrome, because people with Down syndrome have 3 copies of chromosome 21. And on chromosome 21, there's also a gene that is involved in creating the protein that clumps in the brain in Alzheimer's disease. So we think this is why people with Down syndrome have a much higher chance of developing Alzheimer's. So in terms of learning disabilities more broadly, I'm not sure, but there's a direct link that's been well established with Down syndrome and Alzheimer's disease.
Thank you. Yeah, that's an interesting question and interesting answer as well. A good one now. So Artist Kid 21 has asked, is it true that mobile games like Candy Crush helps to keep the brain ticking?
Yeah, absolutely. So I think one of the modifiable risk factors, one of the things that we encourage, is that anything that keeps your brain stimulated is good for your brain. And I think it's good to find what you like. Because, sometimes people say, oh, you should read or you should do whatever, find something that engages your brain that you enjoy. So video games, Candy Crush, writing, journaling, reading, music, a lot of creative activities and games are actually really good for keeping our brains sharp, because when we're playing things like Candy Crush, we don't think about it. It just feels like fun, but you're doing pattern recognition, you're doing all these there's a timer, there's these colors, so it's actually stimulating you. So yeah, I think it's always good to just find things that engage you and keep your mind active, and that's a good way to protect your brain.
Yeah, mobile phone in moderation.
Yes, in moderation.
Okay. So a question, I don't know if you'll be able to answer this, but can foot pain be related to dementia?
Foot pain?
Yeah.
Not to the best of my knowledge, no, not directly. Not to the best of my knowledge.
Okay. And next question. You've got lots of questions coming in, so your brain is being exercised tonight. can dementia be inherited? So I don't know if Kehinde came in after you presented that.
Yeah.
If you could just mention it again.
Yeah, sure. So in the presentation, I mentioned that 1 in 100 cases of dementia are inherited. So there are some known faulty genes that cause dementia. So so if you have a specific mutation, a certain gene passed down, you will 100% get dementia. This is more common in frontotemporal dementia, but there's also some forms of Alzheimer's disease, especially early onset, that are genetic. But most cases of dementia are not inherited. So majority are not, but they are. And usually with the inherited ones, you typically can actually see in the family that, like, you know, the great grandma and then the so usually if you look back generations, you'll be able to spot it. But if it's just like one person and then there's no one else around, then it's more likely to just be sporadic by chance. Yeah.
And as you said, there's lots we can do to reduce, can't cure it, but we can reduce our risk by healthy lifestyle and
and even somebody when you do have dementia, and I think it's really important what happens sometimes, depending on the cultural context, how your family decides to kind of cope with it. Sometimes then people hide the people with dementia away and keep them in the home and not stimulated, which actually speeds up their decline. So actually that's why making sure that they continue to be engaged, go outside, do activities, have therapies, can actually keep them around for longer. Like, we know that they will continue to decline, but I think it's really important to make sure that somebody has the best quality of life that they can to the very end, So just making sure that anything that you can do to make them comfortable and to keep them engaged is really valuable.
Okay, yeah, thank you. Pimeo has asked another question with regards to learning disabilities, and you mentioned Down syndrome, but I don't know if this is just generally or with regards to dementia, but they ask what can be done to help people with Down syndrome. So I don't know if that's general, because that's a very big
yeah I mean,
question.
I'll say that's a bit out of the scope of my what I know, but what I would say is that, like, I think what we're learning is now with better services, better resources, and better research, people with Down syndrome are living much longer than they used to, and many of them are having, because it depends as well, like Down syndrome is obviously this diagnosis, but people still with Down syndrome exist on a spectrum, so some can be quite able-bodied, functional, able to engage, work, etc., whereas some need more care. So I think it really depends on the individual and making sure that that person's individual needs are being addressed, because for some they can't, it's a very severe learning disability, but for many, they can have, full lives. So yeah, again, it's quite a broad question, but that's my perspective.
Yeah, they'll come back to say, related to dementia. Please do use your mic as well. It's nice to hear people's voices as well, and you can have that discussion, that open, free discussion. Just a couple more questions which have come in, or a question which is coming. They're saying how, I guess this is, you can't really gauge this one, measure this one. How frustrating is it to care for a dementia patient as a carer, and what are the guidelines to follow? I guess to deliver proper care. And someone has commented that they've said it's like watching a person die every day. I don't know if a person sharing their own personal experience or what they've seen or what they've read. It's very frustrating and sad.
Yeah, it's heartbreaking. It's like watching. It is like watching somebody dying, but then they're not actually dead. It's quite devastating. But to answer that, I mean, again, it's that's why I had the slide as well in the presentation where I mentioned the impact on the caregiver is very heavy. It's not an easy thing to experience on many levels, emotionally, financially, practically. I will share the resources, like in the UK, at least, they have even support charities, Carers UK, Carer Support, to kind of provide like meaningful ways to support people, because it's really important that you take care of yourself, because you can't care for someone if you're not doing well. But sometimes it's easy to say that, but that's not always a practical thing, depending on your financial situation, depending on your family situation. I think the big thing is just making sure that you have a good support system if you can. It's not a one person role caring. It's really helpful if you have other people that you can share the load with, that you're able to step away when you need to, so that you have the energy to show up. Because unfortunately, with dementia, it is progressive. The person will continue to get worse. And so you have to kind of be in it for the long run. So figuring out how can you sustainably be able to show up for the person without running yourself down, which I don't think there's one answer to that. It's something you have to figure out within your resources and your circumstances and your community. Yeah.
So carer has to be looking after themselves in order to look after their loved one. And so yeah, Artist Kid who said it was like a person dying every day, did say it's from their own lived experience. So thank you for sharing that with us.
Yeah, thank you for sharing.
Someone has said that we do need more presentations, I guess, of this on this subject. So yeah, I think a lot of people have found it very interesting, engaging, and something which will affect some of us in some way or another, either as a carer or unfortunately for ourselves as well, or it could be a best friend who has developed dementia later on in life.
It's really important just to inform yourself, because it's a scary diagnosis, it's a scary thing, but I think the more you know about it, then you're more empowered to make the right decisions for either yourself or for your loved one. And sometimes all you can do is face it head on. But I think being equipped with not even like just the modifiable risk factors, knowing that, okay, if you have hearing issues, it is worthwhile to get a hearing aid, because sometimes some people are resistant to things like this. And it's like, if you know that, okay, this could potentially reduce my risk of dementia quite significantly, then, it just helps encourage us to do these things, reducing drinking, smoking, etc. Like, we will all age, but we can age healthily. There is something called healthy aging, and there's much we can do. Someone has their hand up.
So, Bishi.
Hello.
Hi.
Hello, everyone. Yeah, sorry, I actually came late, but I just have a question. Recently, I got to. I think mine is memory loss, because immediately I came in, I was lucky to get to exactly why I really really wanted to join this session. Thank you so much for organizing this session. I would say on my own part, personally, I'm just having issue with memory loss. I forgot things a lot. So I don't know what, but like someone advised me to use Google Calendar. It has been helping. So I won't put too much pressure on my brain, like trying to remember so many things at the same time.
Yeah.
So I'm just trying to share my experience. If people can do that also, it's helping. Then I want to ask, is there any, let's say, multivitamin or something someone can take to improve health, brain health, something like that? Yeah, that's the first question. Can I ask the second one?
Sure. Can I answer your first question first before you?
Okay. All right.
Yeah. Thank you for sharing. And I think it is a really good, like, finding tools and resources to help you is always beneficial. So because the thing is, sometimes we just get overwhelmed. It's not even that, like, it's dementia, like you just have too many things going on. So if using a Google Calendar or something is helpful, then I think that's really good. In terms of the multivitamins and supplements, so far there's no research to support any specific multivitamin, like, reducing the risk. However, I think it's really more about making sure that you have a really balanced and healthy diet. So if you know that you have some deficiency in something, for example, I live in the UK, so most of us here are vitamin D deficient, right? Making sure that if you know your levels, have to supplement. So understanding your body and what you need and being healthy, then fixating on a specific supplement, because everybody is different,
Okay, yeah, I understand. Thank you so much. What about do you think doing a night shift consecutively can increase the risk of memory loss?
Yeah, that's actually a great question because there's actually a study, a big study that's been done in the UK. It's called the 1946 study. They've been following a group of people for I don't know how many years. They were born in 1946, and they checked if people who were doing night shifts had higher risk of dementia, and they didn't find that actually. So seems it doesn't. From
So
the data
there is
that we have, it doesn't seem
no
to.
research to prove that.
Yeah, so far there's no research to
Okay.
support that. Like we don't have any
Okay.
evidence to say it
Yeah,
completely.
yeah. Because sometimes I feel like I do, let me say I do like 3 night shifts in a week. That's
Mhm.
the highest I can do. I can do 4,
Mm,
not all the time. Though mostly I do 3 or 2. So
mm.
I'm just thinking, is it too much for me? Maybe that's why you
Yeah,
understand.
yeah, I understand. I think it's just important. Like it might be less than night shifts and more. Are you getting enough sleep? You know, and
Yes,
so
yes.
regardless of whether you have night shifts, are you making sure that when you do sleep, you're getting good quality sleep? I
A
think
good
that's more
quality
important. Yeah.
sleep. Okay, all right, yeah. Then I just want to talk generally. I'm sorry I'm taking time. Like I'm a caregiver, I'm a support worker in the South Mid Hospital. I go to a dementia ward a lot. There's a ward for dementia in South Mid Hospital. It's very draining. I can't even imagine my enemy being having a dementia. Like seriously.
Yeah.
Yeah, you can see some dementia that's so bad, they're very aggressive. They
Mm,
don't even they don't even want you to care for them.
mm,
Sometimes you just have to go out of our way.
mm,
Like we have to like 3 people, 4 people holding up. So we're able to change that part. It's sad.
mm.
Yeah.
Yeah, it's devastating. Yeah, it's really, really difficult,
Yeah,
even for
because
carers. Yeah.
some people may just be having dementia, but when you don't experience, when you don't see it physically, you won't understand
Yeah,
how bad it is. Yeah.
absolutely.
So if anybody is having a kind of opportunity to do a voluntary, if a voluntary something for it, it's worth it seriously.
Mm,
Even if it's few hours, like 2, 3 hours, it's worth it.
yeah.
All right. Thank you so much.
Thank you for
Yeah.
sharing.
Yeah, thank you so
I,
much. My hand was up. My name is
that's fine.
Bukuto.
Yeah, I'll come to you. Yeah, yeah. And there's one more question, and yeah, I don't know. I'll see if we have to round it up then. But yeah,
I think we can extend it to allow people ask questions.
yeah.
If Natasha, if you don't
Yeah,
mind,
yeah. No,
Natasha,
I'm happy
thank
to
you.
stay a bit longer if
Let's
there's more
allow our
questions.
people to ask questions. Thanks.
Oh, lovely. Oh,
Yeah,
over to you.
what I was saying is that, especially with us from the black community, we tend to spend time working. Even when we are sick, we just go to work. It was really good to hear, Natasha, what you're saying, that small things like ear infection, small things like drinking alcohol, and we know that a lot of our family friends, they drink quite a lot as a
Mm,
distressor. So to me, I think what we can do, this is just me now thinking forward, what we can do, because this meeting, I think we need more people from our community to attend meetings like this, especially what you've just shared today. These are basic things we can do on day-to-day basis. And if people can hear you again, more people can hear you, that small things like infection, if you have an ear infection, it can really lead, or it can really contribute to you developing dementia quickly, or drinking like we tend to do, or like that other sister was talking about, at times working quite a lot,
mm,
because when you're working, you don't even feel, you lose that really sensitivity to know if you are not well or not. So
mm.
I think the best thing is, as if you can do it again, we'll try to bring as many people as possible so that they can hear.
Yeah,
And
absolutely.
yeah, I think it's a good thing you've done today. Thank you so much. We really appreciate that.
No, thank you so much, and thank you to the ALIBSA team for inviting me. I care a lot about this. I think I briefly mentioned I do a lot of public engagement work to speak with people from the Black community. Obviously, I'm based in London, so far it's been London, but I'm trying to get funding to kind of take the workshops outside of London. So obviously we're all over the country, because yeah, we need to have these conversations. We need people to just like the way we today were just able to talk with each other in kind of a safe environment. People can ask their questions and find out that they're small, like very small things. They're not, the things sound, they're not small actually. It's actually impactful for your body, but it's things that they're doable. Just don't smoke, don't drink too much. make sure you're working out a bit, take care of your eyes, your ears, make sure you're socially connected. I think there's a lot of loneliness that happened, especially from COVID and onwards, and people becoming isolated, and especially older people, sometimes they can become isolated. So it's also like a call to action that if there's people in your lives who are older, who aren't coming out, go visit them, spend time with people, go to community centers, be with community. It really makes a difference.
Thank you. There is another question, and it's how can a foreigner access dementia diagnosis in UK? So I guess someone who's come to the UK, maybe I don't know if they're registered with the GP or not.
Yeah, I think if you live in the UK, the process would be the same as anyone here. I think as long as because if you're here, then you have access to the NHS. I did mention the disclaimer at the beginning that, like, while I showed you the pathway of diagnosis, I know that's not necessarily how it works in real terms, because people who are in the UK, we know how, even getting an appointment can be a headache, let alone getting a long enough appointment with a GP can engage. But I think that advice I gave about having a journal was something that also somebody who works as an admiral nurse, so these are nurses that are specifically trained to support people with dementia, so that when you come, obviously you have your very short 10-15 minutes or whatever it is in your GP, you already come with your points. You don't spend too much time doing a preamble, so that you can kind of get to the point as quickly as possible. It's frustrating that that's how the system is, but you really have to advocate for yourself, or find a designated person who has the capacity to advocate for you if you're not able to do it yourself. So, yeah.
Lovely, thank you. Are there any further questions? I don't know if anyone wants to put their hands up. Yep. Bishi? Oh, sorry, Bisharat? I'm sorry about the pronunciations. Bisharat? I don't know if you're talking, your microphone is on mute. No. Or pop it in the chat. On me.
Hi, good evening. Thank you so much. I just quickly have a question. So there's a friend of mine, I would have loved her to join, but she couldn't. Our dad is having, I think, dementia. He's in his 70s, and most times she do tell me he usually talks about things that have taken place in his life 35 years ago. Like he will give a full story about, talking about something that took place 35 years ago, and that has been so. She was like, it seems he's going back to, back. So I'm trying to really understand why that is happening. Is
Yeah.
it so how dementia works?
Yeah, so that's quite common. So I'm not sure if you were here early on in the presentation, but I was showing the picture of kind of the brain, a healthy brain and a brain of somebody with Alzheimer's disease. And the region of the brain that people lose with Alzheimer's is the one which controls memory. But what we find is that the cells that kind of encode your memory from when you're a child are the last ones to be affected. So you tend to lose your most recent memories first, and then like the ones that are from longer ago tend to stay. So what you actually find is that so my partner's grandmother had dementia, and at some point she was quite advanced, and before she passed, she just recognized everyone as her high school classmates. Those are the only people that were still there. So that's a really common thing. It seems the way the kind of as the brain is degenerating, it's kind of affecting the newer memories first and then progressively going backwards. So that's quite a common experience. But actually, some people lean into that. So sometimes when somebody's presenting that, people try and correct them or remind them. But sometimes actually just going back there with them makes them feel more calm. Because at the end of the day, they're progressing, and sometimes just finding ways, even sometimes playing music from when they were younger that they connect to can help, make them feel calm, because it's such an agitating place to be, where clearly everyone is saying that you're in a different time, but you don't feel like you're in a different time. That's very agitating. So sometimes just finding ways to meet them where they are can also be helpful in making them feel more calm.
Yeah, someone once had heard the analogy of the memory is like a bookshelf falling. The books at the top first fall first, and they're the most recent memories, where the ones at the bottom may stay there.
Yeah.
Any further questions?
Yes. Can you hear me, please?
Yes, we can hear you.
Can you hear me?
Yes, yes, we can hear you. Yeah.
You talk about ear infection. Does that affect has anything to do with dementia?
So untreated hearing loss specifically. So if an ear infection ends up causing hearing loss, then yes. So generally, if you have hearing loss and it's not treated, then that can be a risk factor. So the important thing is, if you have some kind of an ear infection, or you start feeling like your hearing is going, then go to the GP, go to your doctor, get it treated, get a hearing aid if you need one.
No, I can hear well because about last month I have this serious ear infection. I was having business for almost about 3 days, and my doctor said it's due to the ear infection. So this is why I'm asking.
Yeah, I mean, again, like if you got treated, and then that's the point. As long as it's treated and it's managed, then it's okay. I think for some people, it's especially when they have hearing loss. Some people don't want to get a hearing aid because, I don't know, they don't like how it looks, or it's annoying and whatever. But actually, it's not just because interestingly with hearing, it's one, you become more socially isolated if you can't hear. Two, it actually affects your brain because you're straining more to understand what people are saying, so you're putting more load on your brain. So again, it's just really important, if you become hard of hearing, it's very worthwhile to get it checked, get a hearing aid. They've become really accessible in the last couple of years, so it's worthwhile.
I can hear well. The only thing is I had that ear infection, and I've never had it.
Yeah, I wouldn't worry too much about it. If you had an ear infection, it was treated and you're fine now, then that should be okay.
Yes, I am. Thank you. Thank you very much.
Thank you
for that. Thank you for that question. And we've got Montserrat.
Yeah, thank you, ALIBSA. Thank you, the speaker. It's a very good, interesting presentation. Yeah, it's a lifesaver anyway. Yeah, my question is, I think one of those symptoms, or one of those things that you mentioned that can cause dementia, does that mean that there is likelihood of having that dementia? Like the woman that just spoke now said that she's having ear infection plus vision blurring. Can that mean that the patient is having symptoms of dementia, please?
So I think there's a distinction. So the hearing loss, the vision, the smoking, everything, these are all risk factors, right? And the thing is, it just means that it's increasing your risk. It doesn't mean that you will get dementia. It just means that it's increasing your likelihood, right? So it's just things that we can do. It's the same like when you think about heart health, right? We know that there's things that can give you heart disease, like smoking, like drinking too much, etc. So these aren't symptoms of dementia. When you actually have dementia, what you experience is the things like memory loss, like hallucinations, behavior changes. Those are the symptoms of dementia. So it's different. So you have the risk factors, the things that may increase your likelihood, and then you have the actual symptoms of dementia, which are then memory loss, personality changes, etc., etc.
Yeah, thank you.
You're welcome.
Okay, and Kuhendi said that apologies that they joined late, but can you just repeat the causes of dementia?
So dementia has different causes. Sometimes it's genetic, so you inherit a faulty gene that leads to some kind of dysfunction in the brain. And then in other cases, it's sporadic. So we don't actually know why it's happening, but we know that if there's this collection of risk factors, that if you have them, they will increase your likelihood of developing dementia. So there's certain things, for example, I gave the example of the hearing loss, that we know that untreated hearing loss means that your brain is working harder to understand people, you're becoming more socially isolated, and this can make your brain. There's a concept called cognitive reserve. It's a bit technical, but basically it's the ability of your brain to function, right? It's the capacity of your brain to function. So all these risk factors diminish, they reduce your brain's capacity to function. So I think if you get to a certain degree, then this can cause dementia, if that makes sense. But there's different causes and pathways that lead to dementia. One can be genetic, but others can be insult. And the main risk factor is age. Sometimes it just happens because of all the collection of, like, you know, as you get older, you've been exposed to lots of different traumas, infections, life, you know, the brain does age as well. So it's quite a complex disorder. Yeah. But yeah, I think, yeah, so some of the other context, they'll share the slides and the recording, I think so.
Okay, so thank you very much, and thank you for all the questions. Can I go back to you, Alosh?
Absolutely. Just share my screen.
A very interesting discussion.
Indeed. Really, some really terrific questions as well. Thank you so much for answering all of those very patiently as well. So with that, we really want to collect your feedback about what you thought about this webinar. So it would be wonderful if you could share this scan this QR code, but then we will also put that in the chat as well for you to fill that. It's only asked about 5 questions, so it would be wonderful if you could complete that feedback. So that's really helpful for ALIBSA as a group, as a community, to understand what you felt. So we'll just share that here. Yeah, share that in the chat box here as well. I've shared that in the chat box as well. So please complete that 5 questions, so it won't take you long as well. But it's really important that we capture your feedback in the sessions to make it even better. So that concludes our main part of our May webinar. We've got another really interesting topic coming up next month. So that will be on the 29th of June, which is a Monday, 7 to 8 p.m. in UK time. So the topic for discussion would be healthy diet and nutrition practices in Black and Asian communities. Again, very interesting topic as well. So we've got Vincent Avu, who will present the webinar for us. So please join us next month to understand a little bit more about how diet can play a really important part in that healthy aging that Natasha has mentioned. Thank you so much from the ALIBSA team for joining today's webinar. I think we've got great attendance today. I think we had about 55 people who came in today. And thank you so much, Natasha, for that very engaging presentation, but also the time that you took to answer all the questions. If you have missed this webinar, if you joined a little bit late, this would be uploaded on our YouTube channel. So please watch that on there. And if you have any questions, please raise that during in the community chat. We will try to get those answered by the speaker. Yeah, thank you everyone from the ALIBSA team. I'll just play a video about what ALIBSA is about. So if you want to stick around and if you want to know a little bit more about ALIBSA, please do watch that as well and then get in touch.
My name is Fatiha Nei Odumosu, and I'm an associate professor of physical activity and health promotion in UWI Bristol. I founded ALIBSA and I'm the lead on ALIBSA. So ALIBSA is an acronym from Aging Lifestyle in Blacks and Asians. It's a knowledge exchange program which is focused on improving health literacy among the ethnic minority background. So the focus is on the Black and Asian communities because that's where I'm from and that's where the majority of the admin members are from. And we're quite passionate about reducing health inequalities based on the existing health disparities that I'll call within this group of people.
I'm Chang Ma. I'm a senior lecturer in public health at UW Bristol. So my role within this ALIBSA network is acting as an admin member and also a collaborator for the ALIBSA network, and also helping to promote this network to the Chinese ethnic minority, and also helping them to have a better understanding about the importance of physical activity and nutrition. Through this network, we can spread this physical activity message to the community.
Yeah, the brain behind ALIBSA is made up of 6 admin members, which include my humble self, Alosh Jos, who is the CEO of Cricket Cube, a community-driven cricket business company based in Newcastle. We also have 2 medical doctors on the team, Dr. Giselle and Dr. Abolanle Adisupe, as well as a doctoral researcher, Oluwatobi Fatola. We have Dr. Cheng Ma, who is also a senior lecturer in public health as well. ALIBSA provides a platform whereby community members from the Black and Asian ethnic groups could be empowered through health literacy. And we feel that this would reduce health inequalities among this group of people, thereby increasing access to health services. We believe that when people are literate about their health condition, they have autonomy over their health, they are quite empowered over their health, and they have self-confidence to access health services, and that will go a long way in reducing health disparities among these communities. We will understand the barriers they face in accessing health services, and we can collectively work together to look at a well-tailored form of interventions that would enable them to access these health services. So ALIBSA is a program that helps to empower the communities. We run our monthly webinars, which involves inviting multidisciplinary group of speakers that give tailored health-related topics. And we use this platform to engage the communities on the experience with related topics. Outside the webinar, we have a robust WhatsApp community, which has over 120 members, and we do engage with our community members when it comes to resourcing health services, sharing links on ongoing research, sharing links on how to access specific facilities or resources tailored on health promotion within these ethnic groups. We also have a lot of volunteers who join us. Our webinars are well attended from different countries. This is not limited to the UK. We have people join us from other countries such as Netherlands, Canada, Malaysia, Australia, United States, Nigeria, Ghana, and several other countries. We have volunteers that also act as champions that help move ALIBSA within their home country. We do have a platform as well, which is linked with a championship and volunteering platform, whereby we seek this platform to also mentor early career researchers who are really passionate about lifestyle-related conditions and community empowerment. Our vision for ALIBSA is to ensure that ALIBSA is global. We want to ensure that every country has an ALIBSA champion, and there will be community-driven led health literacy initiatives that would help empower people within the communities. Feel free to join our network. We will strive together to empower the Black and Asian communities. We will ensure we're able to reduce health inequalities within this network.
Thank you everyone for joining us today, and then we hope to see you next month. Thank you everyone. Have we stopped recording?